First of all, thank you very much. And I'm very grateful for the organizers, especially Amina, for letting me into this program. I'm really humbled. So I'm not using any screen. This is the way I do my presentation. I'm not doing any PowerPoint presentation. I'm Clara Chinyere, born Owazie, and I'm married to a German. That's why the foreign name there. So I've been in Germany for over 20 years. I did my nursing in Nigeria and my midwifery. So when I came to Germany with the challenges, and I needed to be here to work here as a recognized registered nurse, which I am in Nigeria. It was a bit of challenges. I went through a lot, and eventually I got there because I knew where I belonged to, and that's why I said I'm not going to take no for an answer. So with the challenges of the languages, I moved on. So after that, I knew I had this burning spirit in me to pursue my career. So I decided to go and do my master's in health and social welfare. So after that, I did not finish there. I had to continue. I did psychology, my master's psychology. And it was in the process of that, I had to look for a job. And already in mind, I had a target in mind. I just didn't want to stop there. So I worked in different hospitals here in Germany, and I worked in nursing homes. And that was the process I had to go through to get to where I really wanted, a topic that I was looking for. So it was when I got to the nursing home that I realized that a lot of family carers, they are looking for somebody to talk to. And it was that gap I was looking for. And I felt I could use my career to fill a bit of gap in that area. So my topic is I'm researching on family carers' experience of palliative nursing care in a nursing home. So as you can see, that I am from the branch of nursing, and my research is on public health at the University of Bremen. So this is my third year now, God's willing, but I have faced a lot of challenges due to COVID and everything. So because I had to work, I had to do my interviews, and at the point whereby you get reply from people and say, no, I cannot take your interview because I don't need a direct contact. Okay. So sometimes I had to start, I had to change my topics, I had to really reconstruct again and pick up again. So as we all know, the old people in our society, the society which we are living globally, more people are growing old. And there's no way we talk about life without thinking about death. Because when one is born, we grow into old age, and there are so many challenges that goes with old age. And that was at the point whereby I think these are people, they're very, very vulnerable, and especially those of them that are not cancer patients. The society, palliative has more priority towards people who have cancer than those with non-malignant diseases or morbidities that are restricting them from doing certain things. Yeah, old age is a normal process, quite all right, but there are challenges that goes with old age. And these were areas that really attracted me, where I said, okay, I could do something with my career. So, and that was when I started. I worked with intensive patients that are on coma, semi-coma patients that are on these breathing machines. And that was what actually gave me the opportunity. I came very close with a lot of relatives who were able to talk to me about the challenges they've been going through. Yeah, palliative care, when we talk about it, is an approach that improves the quality of life. Palliative care is not going to kill, is not going to cure, rather, sorry. It's just to maintain the dignity of a human being so that if the person has to die, the person will die with less pains, dignity, respect, And then when we talk about palliative care nursing, it has to be holistic. It's not only patient-centered. It's a whole pack. And we are talking about not only giving the medication, you're talking about the spiritual needs, the mental need, the emotional need, everything that has to do with the whole package of that human being. And that's why it's holistic. But the problem is that there's been a lot of things going on, that even we have a lot of challenges among the nurses. If you go to old people's home, because I precisely chose old people's home because there are a lot of loopholes, there's a lot of gaps, there are a lot of things that are going unnoticed. People are experiencing things and they don't know who to talk to. So it is in the process of my research so far, the extent I've gone through, that I've seen that, yeah, these people, the voices have to be, and we have to start from somewhere, and somebody has to start talking. So, and that was why I chose this area. And if you ask me, why did I decide to choose this topic in this area? All I know is that before you do anything in life, you first of all have to know, what is my why? Why do I want to do this? These were challenges, the questions that I faced before I made my decision. I asked myself, what do I really want to achieve? Why do I want to go into this area? Apart from my personal pursuits, I am career oriented. I want to do that. I want to be in a place whereby my voice could be heard. And the only way, being a foreigner in this country, I know the challenges we go through. And this is some of the areas that's going to really give me the power to my voice to be able to really argue about this issue, because something has to be done. Something needs to be changed. So we are talking about, there are some principles surrounding palliative care in a nursing home. In a nursing home, especially in Germany, the topic is very, very new. So they give people the chances or the opportunities to choose, because this, you're talking about end of one's life. And end of one's life, one expects that the family, both the patient and the family, should really enjoy the journey, and then at the end of the whole day, so that the family will be able to let go. But one cannot let go if one knows properly that something wrong, something is not going well. So I decided to do my research using a qualitative method. And the qualitative method I'm using, because of the importance, because qualitative method, it's an approach that will really bring me very close to people, to study them in their natural environment. I planned to observe them in the home, but I couldn't do that because of the corona. So what I had to do, I had to change, because that's one good thing about PhD. You can always change at any time. If you know one way is not working for you, you can always change immediately. So all what I did, I had, instead of observing them, I said, okay, let me do this face-to-face interview. And I allow them to choose where would be okay for them. And most of the time, it's been, honestly, it has not been easy. And at the same time, it's been a very pleasant journey. So, and I have noticed that people are crying. They want to talk to somebody. They really want to talk to somebody. Like some of the so far, some of the comments I've heard so far, they're very encouraging. It's like pushing me forward, inspiring me, telling me, go ahead, you're not doing something wrong, you are doing something good. So I want, at the end of the whole day, by the time, like I mentioned initially, there's a hole, there's a gap. There's a real gap that needs to be filled. And the only way to fill this gap, I think, when I work critically, do my research, to be able to recognize all these areas. And then with the knowledge, again, at the end of the whole day, we could sit around the table and then think about how do we go about it? How do we help these people with the experience? Because a lot of them are going through a lot, they have a lot of negative experience. Because now if you go to the nursing home, there are cases of short-staffed nurses. They're not getting the proper information. There is never anybody there to hold their hands, to tell them, to give them the proper information, to educate them, to tell them what to expect. And these are people whose loved one is at the end stage. And psychologically, when are they in the nurses, if the nurses are not balanced themselves, they are under time pressure, they are not able to take care of themselves emotionally, and most of them working there, they lack the knowledge of this palliative care. They don't even know the whole pack. They don't know what is there. So what do you do? I have to go through this, get this, and at the end of the whole day, I plan to get all the parties involved so that we could sit around and find out how do we go from there. And as a Black, the only way I can speak is through my increasing my knowledge, being a specialist in my area, thinking critically. And that's the best way I can handle it. And that's why till tomorrow, I am so glad that I chose a topic that I'm passionate about. I love it and I want to help. And the only way I can help is when I am able to be a professional, a real professional academically in the field. Then we begin to talk. I have to tell my fellow Black people, I am using that word. Don't be afraid to go in for what you want. Don't be afraid. Don't look at the big name PhD, because at the beginning, I was a bit shy. I was a bit, oh God, how am I going to face this? There is no situation. There is the only person standing between you, are the only one standing between you and your success, between you and your dream. It's only you. If you're able to conquer that thing in you, you move the universe, nobody will stop you. So I'm urging everybody, go ahead. If you want to do it, just go ahead. Don't be afraid. As you go along, you learn. We learn every day. There are so many things I've learned in the process, which I didn't know before. But the more we go, we ask, we meet people, and the more we learn. Let's come out from our comfort zone. We have a lot in us, and we're ready to conquer the world. So let's go.